Welcome back. We are going to continue focusing on healthcare right now, but specifically prescription drug prices and inflation. We're seeing prescriptions get even more costly, and that affects many individuals. And we have David Mitchell here to tell us all about this. David, how are you today? Thanks for joining us.
I'm very well, Christine. Thank you for having me.
David, tell me about this connection between inflation and prescription costs.
Well, prescription drug prices keep going up, and the fact is, Americans are paying almost 4 times what other wealthy nations pay for the exact same brand name drugs. The reason is that we have a system in this country that allows the drug companies to dictate the prices of drugs to the American people. No other developed country in the world allows that. They negotiate with the drug companies. And we have a new law called the Inflation Reduction Act, which is for the first time going to allow Medicare, the largest purchaser of prescription drugs in the country, to use its purchasing power to get a better deal for Americans.
And how does this Reduction Act help with prescription drugs and help with the issue with finances and healthcare and how much that can weigh on both our physical and emotional health?
I didn't hear the last part of your question.
Well, I'm curious about not only the Inflation Reduction Act and how this will affect prescriptions, but also all of this comes at a great cost for everyone's not just physical health, but emotional health as well.
There's no question. I'm a cancer patient. I have an incurable blood cancer called multiple myeloma. The cost list price of my prescription drugs, a 4-drug combination they have me on right now, is more than $900,000 a year. Just one of those drugs, a drug under the Medicare Part D prescription drug program, costs me more than $16,000 a year out of pocket. The cost of prescription drugs takes a terrible financial toll. Doctors actually call it financial toxicity, but it takes a toll on people's health because when they can't afford their drugs, and 3 out of 10 cannot, they don't take them as directed, and that hurts their health. We've actually had people die in the last several years who are dependent on insulin because they were trying to ration their insulin. And that's a prescription for disaster. And we've had people actually lose their lives from that. So the cost of prescription drugs takes an incredible toll financially and on the health and well-being of Americans. And the Inflation Reduction Act is going to bring down the prices and lower out-of-pocket costs for millions of Americans.
And what can be done to further protect patients?
Well, we need to implement this law. The law will, as I say, allow Medicare to negotiate and get a better deal. It puts in place limits on price increases year over year. Drug companies won't be able to raise their prices for Medicare more than the rate of inflation. Instead of me paying $16,000 a year out of pocket for that one drug, in 2025, there'll be a new cap on what Medicare beneficiaries pay, $2,000. Starting next year, people dependent on insulin will pay no more than $35 a month for their insulin supplies. So there are a number of things included in this landmark legislation that will, in fact, help people by lowering prices and lowering out-of-pocket costs, and that's going to make people healthier.
And how can individuals specifically get this help that they need, and how can we find more information?
Well, we at Patients for Affordable Drugs are patients trying to help ourselves. Please come to our website, patientsforaffordabledrugs.org. Leave your story, leave your email address. We don't ask patients for money. And we will amplify your story and your experience to policymakers and elected officials to make sure they understand the toll that high prices of drugs takes on people, and that we can demand further reforms to ensure that drugs are affordable and accessible for all Americans who need them.
Well, thank you so much, David Mitchell, for joining us today. Really appreciate this very important information about lowering prescription drug costs. I wish you all the luck as you also struggle with your health. So we appreciate you sharing your personal journey with that and how that's affected you, emotionally, also physically, of course. But these finances, the prescription drug costs, has a direct correlation. So we appreciate your information and your time with us today. We're going to take a quick break and get back with much more here on Mountain Connections right after this.